So with this video, we are going to be looking at releasing off the upper abdominal region and the diaphragm muscle. And we're going to try and find a way of helping you to do that treatment on yourself. It's not so easy to do that treatment on yourself, but there are techniques that you can use that will be useful and beneficial for releasing off any upper abdominal tension which might be causing you to grip around your chest, which is then going to restrict your diaphragm movement and restrict your core function. So we're going to use a rubber massage ball to release off the superficial connective tissue and superficial muscles of that abdominal region. This rubber ball is going to grip hold of the skin and the connective tissue, and as we twist it, it's going to massage it and release it and rehydrate that connective tissue, leaving the tissue nice and soft and free, and then obviously your breathing and your core function will improve after the treatment. So we're going to have the upper abdominal region exposed so that you can see your skin. And we're going to start off in between the base of the ribs. So where you've got one rib cage on the left and one rib cage on the right, we're placing the ball in between the two. Now we're gently pressing in to that abdominal region and then twisting the ball so that you can see the skin pulling, and then we release off. And we're going to work along the right rib cage to begin with, and releasing off. Now with this technique, I'm using a clockwise rotation, but you can use an anti-clockwise rotation, which will give you a slightly different stretch. So you can alternate from one to the other. And you'll find that as you move, you'll find points of restriction and you'll find points of tension, maybe even spasm, maybe even a bit of discomfort. Try and focus your efforts on those points, even though they're the points that you want to work on the least. So we've worked along the right rib cage. We're going to move on to the left rib cage. So again, we're coming through. We're just feeling a little bit more resistance on this side. So it's got to be something that feels comfortable and tolerable. Hopefully that feels okay for you.
That's fine.
And you're just going into that level of tension, trying to reduce any grip creases that you might see along the top of the tummy. They won't go immediately, but if you practice this every evening before you go to bed, you should find that over time that muscle then at the top of the tummy becomes looser. Now if you're going to try this on yourself, you want to grab hold of that ball. Let me get out of your way. Okay, so you're going to press the ball into the tummy in between the ribs and twist. And then you're going to work along the rib cage so you can find that rib cage. You don't want to be massaging onto the bone itself. You want to be massaging into the abdominal muscular tissue. And you work along the ribs. You might find that your skin becomes quite red. That's absolutely fine. That just means the blood flow is increasing in that area. And you work along and coming up and over. Generally, if you're tight in the upper abdominal region, you might find that you don't need to massage or release down here. But if you have had a cesarean section or abdominal surgery, you may well find that massaging lower down can be quite comfortable as well. It would be the same technique, just a different location. So you might not be able to get the same pressure or twist, but it'll still have the same effect. Excellent. Brilliant. So that's a video now on how to release off the upper abdomen and the diaphragm, and you should find then that the tummy feels nice and soft, that it's not restricted in any way, and you should feel that you can then get underneath the ribs to be able to access that diaphragm muscle a little bit easier. And you should find then if you take a nice deep breath down into the base of the ribs, you can feel a good stretch through that area, and there's less restriction pulling against your rib cage as you try to breathe in. Good, and you get a nice softening through this tummy rather than a gripping band. That's an excellent response to that treatment there. Really good. So have a go at that on your own at home. If you have got a friend or a family member who could help you, you might find that that's a little bit more effective and easier for you, so that you can focus a little bit more on releasing off and relaxing and breathing during the session.